Hi everyone, I'm Dr. Shu, and today we have our lovely patient Adriana. She comes here because she's interested in having a breast augmentation with implants. It's something she's thought about for a long time, and so one thing I wanted to share with you all is that I always review the history of implants with each implant patient, just because it provides context and a little bit of history about all the different types out there, and then the ones that I like to use and the reasons why. So here on our stand, we have a smooth round silicone implant, and this is the one that I use essentially 100% of the time. After that, there is a smooth round saline implant, which is also a silicone shell. And the third one is also silicone, but it's a textured implant. And don't use the second or the third ones, and I will go over a little bit of the reasons why. So the top one is a gummy bear implant, which is the most innovative and advanced type of implant that we have, and it's called a gummy bear because when you cut it in half, it actually stays in place like a gummy bear, so that makes it very cohesive, and it's an improvement on prior types of silicone because if there is a slight rupture or a tear in an implant, which is one of the things that can happen over years and over time, it tends to stay more intact rather than ooze and kind of leak out freely. It has a smooth texture on the outside. It feels very natural and it looks really natural in the chest. So this is the one I primarily use. This one, the saline implant, it kind of, as you can see right now, is filled with air and feels like a water bag when it's in the chest and actually filled with saline, which is just salt water. This type of implant is more just an historical artifact. A lot of patients in the 1990s had a lot of silicone implants that were saline filled because there was a lot of concern at the time about the safety of silicone in the body. And since then, there's been a lot of medical research that has shown that we can actually safely transition to this type. And so since the early 2000s, there's really been a shift away from saline. A saline implant just doesn't feel or look as natural in the chest. But one of the slight benefits is that if you're really worried about knowing if you have a rupture or not, if this ruptures, it will actually just deflate in the chest, so it would be very obvious if it does rupture. The last type of implant is a textured device, and typically these are used when an implant that you put in is shaped like a teardrop. I don't use these at all in my cosmetic practice because typically I only need a round shape, but it creates a teardrop in the chest.